continuing the previous lectures on the topic of medical ethics. Many aspects we have discussed so far, the various situations in the medical practice we have discussed. There is another aspect where we have to follow certain ethical aspects in the research process. Research is basically an important aspect in our medical field because the progress of medical profession, it is based upon the research. The research may be observational one, or it may be involving some experimentation or the analytical type of research. So when we are confronted with such sort of research which involve certain experimentation, and particularly these experimentations, they involve the animals or the human subjects. Here anybody who is being involved as a subject in the research process or research project, there is a protocol how this person should be taken care of. So another aspect which we have to take care about the environment. During our any sort of experimentation, we have to take care of the environment. It should not be polluted from your chemicals which are being used or anything which is being produced during the experimentation process. In addition, welfare of the animals used in the research, it should also be respected. So the human beings or the animals and the environment, all these things should be taken care of. Now what are the basic principles which are to be followed when we are dealing with the medical research? The basic principles, one is it must conform to the generally accepted scientific principles and should be based on a thorough knowledge of scientific literature. So the important thing that the person who is planning to conduct research, he must be well aware of what he is going to target. He must have a thorough knowledge about the scientific literature. And what project he is planning, it should be prepared according to the accepted scientific principles. The experimental procedure involving the human subject should be clearly formulated. It should be conducted only by the scientifically qualified persons and under the supervision of the clinically competent medical person. So the project head, a medical man, he must engage the team who are scientifically qualified persons so that in the collection of data, they will have more secure mechanism. Another very important aspect is that the subjects which are being involved in the research, their well-being is the responsibility of the person who is engaging them. It should rest with the medically qualified person who is in charge of the research project. And it should never rest on the subject of research. Don't leave it to the person who is being made the subject in the research, but his or her well-being should be taken care of by the person who is conducting the research. Biomedical research involving human subjects should not be carried out unless the importance of the objective and the inherent risks are assessed. It is very important point. We have to see whether the risk to the subjects or the human subjects, they are, if significant, then we have to consider whether this research should be conducted or not. So in case there is a risk is more than the anticipated benefits we are going to get from that research, it, that research should be dropped. Medical men should abstain from engaging in research projects involving human subjects unless they are satisfied that the hazards involved are believed to be predictable. Doctors should cease any investigation or any sort of involvement of the subject in the project if hazards are found during the running of that project. And in that situation, and these hazards are found to be outweigh the potential benefits. So that subject has right to withdraw him from the research if such sort of situation occurs. Concern for the interest of the subject must always prevail over the interest of science and society. So, nutshell, we can say that whenever you involve a subject during the research, mostly the human subjects are involved in the research when we want to assess the efficacy of some drug. So, when a drug you are giving, there are potential hazards of getting side effects. If the person develops significant side effects, then you have to stop the administration of drug to that person. So, another very important point which should be important to take care, and that is the to respect the privacy of the subject. If someone is being engaged, don't reveal his inclusion to anybody else who is unrelated to the project. Another very important point is the physical and mental integrity of the person should be taken care of. And it does not have any negative impact on the personality of the subject. These are the various aspects which we have to take care of. While you are getting your research published, so the doctor is obliged to convey the results accurately. It should not be manipulated or tempered. And reports on experimentation not in accordance with the principle laid on in this declaration should not be accepted for publication. This is another advice for those who are authors or who are the editors of the journals. They should not publish such sort of research which is not providing the true results or which is not being written according to the prescribed standards of research. Now, very important aspect which when we are treating a patient while examining or taking the history or prescribing any sort of treatment, we get consent from the patient. Similarly, in the research project, when any human being is being involved, get consent from that particular person. And this consent should be freely given and it should be an informed consent. Informed consent means in this situation, the subject must be adequately informed of the aims, the methods, what is the aim or objective of the study, what methodology has been adopted, and what are the anticipated benefits and any hazard if there is a risk, it should be communicated to the patient, to that particular subject. And even the slightest discomfort he might be uh, confronting at any level, it should also be conveyed to him before the start of his involvement in the research. He or should be informed that he or she is free to withdraw his or consent to participation at any time during the research. If the person is not feeling comfortable with this involvement in the research, he can withdraw his willingness or consent at any stage. When obtaining informed consent for the research project, the doctor should be particularly cautious if the subject is in a dependent relationship with him or consent is taken under duress. Now, the dependent relationship means sometimes a boss involving his subordinates in the research or a person who might be involving some relative. So, in courtesy, they may show the willingness, but that is not the ideal situation. Or sometimes they get in themselves under pressure because some boss may be asking, you are included in my research project. So it is best advice that the consent should be taken by a person who is not engaged in the investigation and has no relation or any concern with the subject who is going to be involved in this research. So any sort of pressure or duress in this way, it will be eliminated. The informed consent, it should be obtained from the legal guardian if the subject is not competent to give the consent. Okay. The competence mean that person because of some mental incapacity, he is not mentally fit, but he is maybe included in that situation, the guardian, the legal guardian should give the consent for inclusion of the subject in research. Similarly, if the individual involved or the subject is minor one, below the age of 18, then in that case, the legal guardian should be referred for getting consent. The research protocol should always contain a statement of ethical considerations involved and should indicate that the principles made in the present declaration are complied. When you write up your research, this aspect should be included in the research. This was all about the various ethical aspects which are being confronted in various clinical settings. Another topic very small topic, that is the medical documents and the reports. It is not concerned with the medical ethics. That topic is now finished. Now, this topic of considering the various medical documents and reports during the professional activity, what sort of documents we are preparing, and how the records are being maintained. The registered medical practitioner has to prepare certain documents during his professional activity for the benefit of the patient, for the benefit of his colleagues, or to meet certain administrative necessities of the guidelines. Maintenance of records help to evaluate the prevalence of disease and to make the health plannings accordingly. So, how these documents and what are the various documents we have to prepare during our clinical practice. A medical document should be in accordance with the specific protocol to fulfill the specific objective for which it is being prepared. A performer should be developed so it will provide a uniformity. That performer, wherever it is being used, it will be have the same uh, format, and the similar standard of observation may be observed wherever it is being used, that performer. The various types of documents which we are preparing or we have to prepare in our day-to-day clinical practices. Number one is the medical prescription, second, medical certificate, thirdly, medical report, fourthly, medical notification, and fifth, the maintenance of medical reports. So these are the various documents. Now, one by one, I will give you few lines that what are the necessary points to be followed while preparing all these documents. So the out of all these five, the prescription, it is the most commonly prepared document, and whereas the medical certificate is the most important and sensitive document to be prepared. So keep in your mind that the certification is a very important uh, when a doctor has to issue it. You have to prove your competence, and in addition to that, you have to prove your integrity as well. You are a professional, you have to prove your integrity as well. So when we are preparing such sort of various documents I have mentioned, the protocol for prescription, certificate and report and notification. These are the four documents. They have something, a common pattern of making such sort of documents. They have got three portions. In the first portion, we write down the biodata of the patient. In the second portion, biodata of all the details which are being required in that particular document, these are provided. And thirdly, we have to provide the identification of the medical practitioner. So these are the three portions: biodata of the patient, the detail of the information which are required to be presented in that particular document, and thirdly, the identification of the person who is preparing this document. Although there can be differences in the details provided in the documents, depending upon the proficiency of the practitioner who is preparing that document. But as I have already told, that if a proper format is opted at some national level or institutional level, then we can standardize our work and it should be a better option. So taking the first one, that is the medical prescription. Prescription, you are very much familiar in day-to-day practice. Doctors have to issue the prescription to patient after examination, taking history after examination and prescribe the treatment in the form of a prescription. Basically, the prescription is a direction of practitioner to the pharmacist through his patient. That prescription is handed over to the patient for dispensing of medicine in the form indicated in the directive. The detail, what is going to be prescribed and how it is to be taken, it is written in the prescription. It usually starts with the letter R, which is the symbol for the recipe, which means take or see the prescription. Next, we write down the name of the medicines, its concentration, and direction for its use. Medicine name, how much milligram, for example, we are giving an antibiotic or any painkiller whatsoever, the capsule so and so, 500 milligram, and direction for its use, how many times it has to be taken in the day. While prescribing a dangerous drug, a superscription should not be omitted. It should be written. It is basically that superscription is basically the instruction that how many times this prescription should be repeated. The dangerous drug is the word used for those drugs which are having the potential of uh, addiction. So such sort of drugs which have potential of addiction, they should be given for a specific period of time, and that number of time this prescription may be repeated, it should be clearly written so that the person may not misuse it permanently. Second is the medical certificate. Basically, the three portion biodata of the patient and biodata of the doctor are the common for all these documents. It contains medical facts elicited by the medical examiner during the medical examination. While performing the examination, the doctor note down his observation. And such sort of certificates may be regarding the ability, working ability of the person, or maybe his or her incapacitation. Working ability means a certificate of fitness, or incapacitation means the certificate of sickness. Person is unable to go to his college or school, or not possible to attend the office. Or the person may be suffering from some trauma, or the injuries are there, you or the person is exposed to some sort of sexual assault. All these findings are being recorded, and a certificate is issued in such situations where the physical or sexual assaults are involved. We issue the medical legal certificate. So if we are recognizing the phenomenon of death, then death certificate is issued by the doctors. Similarly, if we want to establish the cause of death, after opening the body, we issue autopsy certificate. According to PMDC, no certificate is valid unless signed by a registered medical practitioner. That is the privilege with a doctor, that he can issue his medical certificate. When you are preparing the medical legal certificates, then identification mark of the subject are also included. The examinee, the examine identification mark present on the examinee, these should also be included. Usually, this certificate starts from the phrase, "This is to certify." The rest, you will get the statement what you have observed. Medical reports, these contain the certain inferences or results drawn by the medical officer or the doctor. The various laboratory reports, for example, urine report, blood report, X-ray report, these are various materials which are processed in the lab, and then certain observations are made, and then the the reports are prepared by the doctor, and they are given to the patient for, basically the reports are the information which are to be interpreted by the doctor who is treating this patient. The patient is only carrying that report. In fact, it is the communication between the two doctors. One who is issuing the report, and second is on the other end who is interpreting that report after examining the patient. Medical notification. It is a medical information, very important and urgent information. If during your practice, if you find some patient who is infected, who is suffering from some communicable diseases. So it is mandatory according to the Municipality Act that you have to convey this information to the relevant quarter. In case the public at large is going to be affected, then district health authorities are being informed, and if that person is a risk factor for a particular area, for example, he is a cook working in some hotel, then that particular hotel manager should be informed that the person is suffering from such infective disease, and he should be kept away from the job so that this infection may not spread to the other person in that area. So this notification, usually narrated in this way, it is to notify that a suspect case of so and so is available. Like suspect case of cholera is there, suspect case of coronavirus infection is there. So you intimate to the concerned relevant authorities that it sensitive information is there. Medical reports, these are basically the patient case notes or the day books or other the registers which contain the medical data. All these registers are kept in the report. All the patient's charts, these are ultimately after the patient is discharged from the hospital, these are kept under custody in the hospital. Subsequently, at any stage, this data may be used as and when the need arises. Such data sometime may be asked in the courts. You have to produce such sort of reports in the court, or you may need sometimes such data for the research purposes, or sometimes patient comes after a long time and he may need your again consultation. Then you can refer to your uh, these previous reports, and these are very helpful. That was all about the various documents which doctors prepare during their practice, and these are very important. I have given you a